We continue to follow the latest developments surrounding the death of Detroit Police Sergeant Kenneth Stile. He died from complications before being released from the hospital. It's suspected those complications were from a blood clot.
Well, we want to bring in pulmonologist Dr. Warren Fields from Beaumont. We're going to talk more about the seriousness of blood clots. Thank you for joining us, doctor.
Welcome.
So are there any signs or symptoms when you have a clot?
Well, blood clots are considered a silent killer. There aren't many symptoms. Blood clots typically start in the leg, and you may notice leg swelling or pain in that area. More serious symptoms can include blood clots which have then traveled to the chest. Those include shortness of breath or chest pain most commonly.
And these are concerns, especially when you have people who are in the hospital and may be bedridden for periods of time.
Absolutely. Immobilization is one of the primary risks for developing a blood clot. There are procedures in every hospital in an attempt to stop or prevent these from happening, but it can be commonplace despite that.
So in a situation like Sergeant Stile, and here he is recovering from surgery,
Yeah.
Is this something that went unnoticed? Like, is this something that a doctor should have seen, or?
Unlikely.
Okay.
Blood clots can happen like this and potentially be life-threatening despite the prophylactic measures that we take commonly in the hospital. There may be very little in terms of warning signs.
Obviously, one of the things that hospitals recommend that people do if they're going to be there over a period of time is to get up and walk around. That's one of the precautions that we're talking about here. But what are some of the other things that patients and their families can look out for that can or should be suggested to prevent something like this?
Well, immobilization is one of the main risk factors for this. So sometimes patients can't get up and walk around due to their illness. If that's the case, making sure and double checking that those preventative measures are in place. Sometimes there's squeezing boots that we place on patients. All patients get a low dose of heparin or blood thinner to try to prevent these as well, and be on the lookout for anything happening, particularly in your legs.
All right, sad state of affairs we're going through with Detroit Police, but we thank you, doctor, for being here to shed some light.
My pleasure.